So let's talk about secondary factors. What are the secondary factors of personal injury attorney referrals? Well, first of all, be aware that we call them secondary factors because they're secondary. So when you're communicating with the attorney, don't emphasize this or make these the selling points, because they are not selling points. If anything, they won't get you business, but if you don't do secondary factors, they will destroy the business. So let me go through the secondary factors here and then just make some comments relative to them. Number one is one of the things that really gets the attorneys frustrated is not getting the narratives and reports on time. And in other words, the attorney requests the narratives and reports, and time goes by, they don't get them, then they have to request them again. Doctor doesn't do them, and then they have to request them again, and the doctor doesn't do them. So now, as the chiropractor, we know what the problem is we don't like doing notes, number one. So that's the main reason they don't get done. It's no fun. And so those are the things that we procrastinate on and push aside. And then a lot of times there's bad systems. And so bad systems creates extra amount of time and energy, and because you know it's going to take extra amount of time and energy, you'll push it off even further. But be aware, sending the personal injury attorney the narrative reports in a timely fashion is a big reason that gets them mad, okay? And general consensus is 3 weeks from the request, but ask the attorney, just ask the attorney, what time frame do you expect this in? And so you have a paradigm. Now, one of the things that I do suggest strongly that the high-end chiropractors do that do have large offices or multiple offices is dictation. If you're still writing notes, that's bad news. Dictating your notes, your SOAP notes, your narratives, and your periodic medical reports, and having them transcribed is the way to do speedily and easily. So I strongly recommend dictation for that, to get that over and out of the way pretty fast. Okay. So not getting the request on time. So if you want to help to destroy your personal injury attorney referrals, don't get them the request on time. So number two, billing for reports and narratives. And here that's a mistake. And the reason it's a mistake is from let's look at 3 reasons. Number one, the competition doesn't do it. See, there will be other providers out there that won't bill for that. Number two is the personal injury attorney expects that. So they expect that as part of a service. So be aware of your primary target's expectations, what they think is normal. Remember, it doesn't matter what you think is normal. It matters what your target market thinks is normal. So they expect reports and narratives as just being part of your services and fees and what you do. So that's a major factor. Here's the real negative to this, is for them to cut a check, even though it's going to be paid later and it's going to be taken out of the settlement. It is very negative to upfront money, and it's not just the amount; it's the fact that you're upfronting the money. And so remember, when you're asking for money up front, it's money out of their pocket, even though they're going to get reimbursed. So it's a very negative from their perspective. Okay, so you got 3 reasons why not to bill for medical reports, and I never billed for reports for my circle of influence referring attorneys. My narratives and reports were no charge. And that's what I do suggest for the reasons that were just cited. And they will find somebody else. And again, this is a secondary factor. So if you're going to do that, certainly don't overbill. And if you do that, make sure you're giving them good content relative to what you're giving them. But I do not recommend that with the referring attorneys. And remember, these are secondary factors. This is not a reason that they will pick you and refer business to you. Don't use this as the primary leverage factor. These are secondary factors. I'm already going to go into need and primary service factors. These are way on the back burner. So a third secondary factor is calling the attorney when the patient's lost. Not when the patient misses the appointment. You should have a capture system in your office of regular follow-up with the patient and capture them. But if for whatever reason you don't recapture that patient misses and you can't capture them and you're losing them, within 24 hours to 48 hours, no more, I'd be calling that attorney, and that'd be a service, because that attorney knows that missing those appointments is going to really hurt those cases, and they're an authority figure. They'll have a significant influence in getting that a patient to do what they need to do. So I've definitely seen attorneys, attorneys get mad at the provider because they didn't even know, they were notified that the patient stopped coming in for care for 2 weeks, 3 weeks, or a month or something like that. So pay high attention that missed appointments needs to be controlled at an exceptionally high level. Let me make one more comment based on the billing reports, the number 2 we just talked about. I had another client just talk about, they were referred, he just lost a major referring case. They had a large personal injury attorney, and I think he told me the previous year had referred him over 25 personal injury cases the previous year. And they asked for a narrative report, and one of his doctors got mad and wanted to charge him like $600 or whatever for a narrative report. And, he came up with all his own reasons. Remember, you can justify anything. In your mind, you'll justify anything. And is his report probably worth $600? Yeah. Is his time and effort worth something? Sure. But now let's put it in perspective. The personal injury attorney firm sent him 25 personal injury cases the previous year. Do the math on that one. And after that, the dissatisfaction was so large they'd only gotten one case in the last from that point forward. After his partner helped lose that business by billing for a $600 report. So let's say you're going to lose $100,000 to $200,000 because of a $600 report. So put these things in perspective, okay? And he had trouble. The client of mine had trouble trying to get that doctor to understand that his $600 report cost them about $150,000 to $200,000 in 1 year. And of course, those relationships go on. So number 3 was the attorney, calling the attorney when the patient is lost, the importance of that. Number 4 is the appropriate diagnostic testing or timely diagnostic testing. And so an example here is the case goes on, and maybe there's a secondary or tertiary problem, maybe that you don't particularly deal with, somebody else, another provider might deal with it, and you really don't follow up and get that done. And then the attorney's requesting notes, trying to settle out the case and get everything together, and it turns out that the patient still has an ongoing problem that was never properly followed up with diagnostics and treatment, etc. So it really puts the attorney in a bad position. And some of the factors that are happening with that is, if there's X amount of PIP coverage, it's no-fault states, the consideration for the doctor is, well, that's PIP money that's going to other providers, etc. Well, you can look at it any way you want, but from the perspective of where did the business come from and the relationship of that personal injury attorney relative to that business, and am I going to look at this as a get rich on one case scenario, or just be very good with that one case and do it right, maybe not make as much money, but maintain and establish the relationship for continued business. So that's really the ultimate question, is whether or not you're going to maintain and that business and move forward versus destroy it. So that is some of the factors that I've seen. Most of it's not negligence as much as just being concerned about the available PIP coverage. So it's certainly a consideration, but I'm looking at ultimately the business relationship and where did I get the business from and how it's going to affect that. So number 5 is accepting their phone calls. With the attorneys going to court, and I always accepted the attorneys. My staff was taught that when the personal injury attorneys called, to interrupt me unless I was doing a report of findings with the patient. That was really the only time that they weren't supposed to interrupt me for a lot of different aspects. But that's a high priority phone call, especially if it's in your circle, your 3% circle, personal injury attorneys. I'm going to accept that phone call for 2 reasons. One is that sometimes it's hard to get them back. So when I finish up and I call them, they're in with a client or they're in court. Most of the time they're in court. So I can't really get them in court. So I do recommend from a service factor that you do accept their phone calls live. So have your staff trained that when the attorney calls, and whatever exception you want to give, that they go through. So if I'm doing a regular treatment with patients, then yeah, my staff is told to interrupt me and get me on the line. That patient will be fine. They can be put on therapy temporarily or wait a few minutes. But if it's a new patient, no. Or if it's a reported finding, no, because the relationship's too fragile or the information's too important for those two specifics. But routine patients who you see regularly, yes, I'm being interrupted to take that attorney's phone call. And if it's anything of longevity that you need to speak to, you can always just agree on a later time when both of you would be available. But so many times I see doctors just put such a high value on their time and not have respect for the personal injury attorney's time. So all I'm suggesting is just be aware, if you haven't found this out yet, when you don't accept these calls and you try to call back, a lot of times they're busy too, or they're in court, and now you have miscommunication, and miscommunication is not going to help your relationship with referrals. So accept the phone calls live the first time is what I strongly suggest. So those are the primary, secondary factors. Of those 5 factors, the 2 biggest of those are the narrative request on time and billing for the reports and narratives. Of those 5 factors, those are the 2 that are most important out of those 5. Now remember, the secondary factors, where does it lay in perspective to the personal injury attorney relationship? Well, that's why they're called secondary factors. So we do not want to use any of these as a reason to sell or to create need. That is not how we want to use these. And we don't want to use them or intermix them with a primary service factor. So we definitely want to be aware that they're important, but they're not part of the sales presentation and they're not part of the primary service categories. They're of lower value, and they're essentially they're factors that won't get you business, but when you don't do them properly, they will destroy the business. So just be aware of the perspective of secondary factors, okay?